Well, good evening, everyone, and welcome to the Aging Heart with Dr. Affleck. My name is Brian McKay. I'm a vice chair of the board of Northern Hearts, and Gavin Nelson, our chair, is unfortunately not able to attend tonight, so I will be your host for the evening. Um, we certainly appreciate you taking time, and we apologize for some inconvenience if it caused you for us having to shift with the webinar 1 week, and glad you're able to make it tonight. Um, the Aging Heart, of course, tonight's webinar is part of Northern Heart's virtual Talk with Doc. It's a program that we tend to provide educational resources to help individuals reduce heart disease in Northwestern Ontario and fulfill the mission of Northern Hearts. As you will see, just a couple of housekeeping things, as you will likely see already, and for tonight's webinar, the attendee video and audio is turned off, but each one of you will still have the ability to submit Q&As, questions to Dr. Affleck that he can address following his presentation. So I'd like to run through the presentation, and then we'll address any questions that you might have at that time. Obviously, you can imagine we're thrilled to have Dr. Affleck speak to us tonight. He's got a very extensive bio, so I had to abbreviate a little bit, so you'll actually have a chance to hear him speak very shortly. Dr. Affleck graduated with a degree in medicine from Queen's University and went on to graduate from the University of Ottawa in family and emergency medicine. He's been an emergency physician in Thunder Bay for 35 years and a past director of the Emergency and Trauma Services at Thunder Bay Regional Health Sciences Center. He's also an assistant professor at Nauseam University and a past president of the Canadian Association of Emergency Medicine and a board member with Northern Hearts. So thank you, Dr. Affleck, for taking the time to speak to us tonight, and I'll turn the controls over to you.
Thanks, Brian. And welcome, everybody. And again, apologies for having to put it off a week. This is my first time doing one of these with sharing the screen, so hopefully it goes okay. As Brian has mentioned, as we finish this up, there will be a chance for Q&As at the end. So just Brian mentioned a little bit about Northern Hearts, and the mission at Northern Hearts is to provide the public with educational resources and heart healthy programs to reduce the impact of heart disease in Northwestern Ontario. So this isn't just a charity that looks after Thunder Bay and region. It is meant to be for Northwestern Ontario. It was started by Dr. Lai and Dr. Hessian about 18 years ago and has done a lot of work in the past. I just joined the board 2 years ago, I think it is, and I've been quite impressed with what all the board members have done over the years. So what I'm going to do in this talk, and I'm going to try to put it into language in terms that everybody from the lay people would understand. I'm going to just take a look at aging in general and how it relates to geriatrics. Look at some demographics in aging because I think they're important. We're looking at the heart. It's actually good news as people are having a longer longevity. Look how aging affects your body in general, doing some physiology. So I'll give you a quick physiology course tonight, then provide a quick anatomy lesson. So this is like anatomy and physiology 101 from medicine. And then describe in terms for some terms for heart function. And as we go through this, a lot of the language I'm going to try to put in, I want to use things like heart function is so that when you speak to your doctor or your specialist, your cardiologist, and they start using terms, you may understand what they're actually talking about. So I'll use some of those terms and explain them. Then I'll look at the heart and the blood vessels and look at how they actually age. And that'll be the physiology of the heart, excuse the pun, the heart of the talk. And then I'll review the implications of the aging heart and then look at what you can do to adjust your lifestyle to help your aging heart. So aging, it's a very topical topic, but it really is taking a look at the impact and the accumulation of a wide variety of changes in your body at both the molecular level and cellular damage over time. And what's really important about aging is it's a dynamic process. It isn't a consistent gradual process. It's a dynamic process. And in the end, aging results in a decrease in both physical and mental health. And with that, there is a growing capacity for a risk of disease. So it not only covers the physical part and the diseases that you may have, it does cover the mental health issues also as you talk about aging. Some of the changes you get as you're aging are like me with the gray hair. Others are not as benign as the gray hair, and others can cause problems down the road as you age, such as heart conditions. So just a definition, geriatrics is the health and social care of the elderly. So that's very important. It's not just the health, it's the social care also, which is extremely important, equally as important as the health or medical side of things. And geriatric medicine itself has to do specifically with addressing a wide spectrum of issues around the elderly. It's the prevention, diagnosis, treatment, remedial, and I gotta move my thing up here so I can see my entire, so the social aspects for the medical care of the elderly. Of note, up in the right-hand corner, there's a picture of Dr. Milady, who's from Mount Sinai, colleague of mine who I know fairly well. The elderly in the emergency department are recognized as a very unique cohort of patients coming into the emergency department, and they certainly are. So much so that it has become a subspecialty of emergency medicine, geriatric emergency medicine. In fact, a lot of the larger emergencies have a geriatric area within their emergency department because the approach and the treatment for the elderly is much different from those that are younger. And he helped create a book with another physician from the States. So this is a North American collaboration on geriatric emergency medicine. So it just shows you how important it is these days for geriatrics and the elderly. So the question is, what are the elderly? So when you look at elderly in the definition, it's really not defined by either mental or medical status. It is defined by actually the age. And over time, the life expectancy has gone up, and elderly typically has been defined as an age greater or equal to 65. England uses greater than or equal to 75 as to some other countries, and in geriatric emergency medicine, we use greater or equal to 70. So this is just a little thing I'll let people read about aging, and gives you a bit of a sense where we're heading and how aging is a normal process and changes as you go forward, depending upon different ailments and issues you may have. So that really is there just to emphasize the fact that as you get older, this is a normal process, and that it occurs over time and it does affect everybody. So a little bit about population demographics, which is really pretty well good news for everybody. If you take a look at, this is what's called a population nomogram, and what it is showing is about the world population and where it's cresting. So you can see right now on the left of your screen that there's a bulge, really the baby boomer bulge, and that's occurring at males who are roughly about 60 years of age. If you take a look on the other side, you'll see it that it's about 65 years for years of age for females. So there's about a 5-year difference in the bulge. And that's reflected in the fact that females have a life expectancy that is longer than males. So that's a good news. You can see that it's happening at 60 and 65. The other good news, if you take a look at the world demographics, so this is affected a lot by third world countries, but having said that, if you take a look back in 1950, the average life expectancy was 50. And as you scoot forward to 2020, the average life expectancy in the world is 75. So over 50 years, life expectancy has gone up by 50 years, 25 years, sorry. So it really has skyrocketed for many reasons. This is what's called a population pyramid, and this is one for Canada. The black line, the thin black line, was what was estimated the population would look like in 2020 when it was estimated back in 2000. So over 20 years ago, that's what the estimate was. If you take a look at the solid yellow, that's where we're at today. So just over the past 20 years alone, you can see that the bulge occurs at a roughly 40, and now in 2020, and that was the estimate back 20 years ago, now it actually is occurring at 65. So over the last 20 years, the life expectancy and the elderly are really bulging within the population. And you can see that here, and this is a whole area in the bulge that is above the black line. And over 20 years, this is what's happened. The average population is aging. And again, for females, it's aging at about the same rate, but a little bit older. So that's good news. It means that there's a direct relationship between time and what we're doing in medical care as to increasing age of the elderly population. When I started my practice in Emerge 35 years ago, I would see a 70-year-old and consider them quite elderly, and I'd see a few 80-year-olds. As I got through the career midway, I'd see 80-year-olds, but I'd consider 90 as being elderly. And as I finished up, and I'd see 90-year-olds in my mid-career, maybe once a month, twice a month. When I finished just last Christmas, I was seeing a couple of 90-year-olds every day, and every once in a while I'd see somebody over 100, and probably even once a month I'd see somebody over 100. So the average age is definitely increasing, as is the health of the elderly too. So a little bit about life expectancy in Canada. You can take a look here that from age at birth, the male estimate was 77, and the males from age 65 were 2.2 years. That means your difference between your females and your males at birth, females are expected to live greater than 5 years more than males. Once you reach the magic age of 65, it's a bit of a magic age. That difference shrinks down to 2.2 years difference in expectations. So when males get up to age 65, they approach that same life expectancy as females, but females are still just over 2 years on average, live over 2 years longer than males. So why? You have to look at smoking, and I think there is a very distinct correlation here. More male smokers than female smokers, and probably not smoking by the time they're 65, because a lot of them have passed away. If you take a look at smoking, and you look at the percentage of smokers, back in 2015, 20% of males smoked, and only 15% of females. By 2021, only 13% of males smoked and only 10% of females. And that has to be a direct correlation, emphasizing how much of a factor that smoking is on your life expectancy, and that has a lot to do with the heart. Senior population in Thunder Bay, this is taken from statistics off the Thunder Bay city website. And it is estimated that from 2016 going up to 2041, that the senior population in Thunder Bay will outpace the non-senior population and go from about 40,000 up to 55,000 in 2041. Now that's a long ways off, but at the same time, as you can see with the population nomograms, every year the average life expectancy is increasing. So that just shows you where we're heading within Thunder Bay, and that's another 15,000 seniors in Thunder Bay coming up relatively soon. This is just leading causes of death in Canada as we get into the talk on your heart and how it ages. And as people probably know, heart disease is the second leading cause of death in Canada. Cancer has been first for a long time. Heart and stroke, which is cerebrovascular diseases, that would be about 65,000 if you added those two together. And then COVID was in there as this was for 2020. The point being is heart disease really is at the top of the deaths, and there's a lot you can do to try to prevent the heart disease from progressing. So right now we go into Physiology 101 to take a look at what happens to your body as you age. And the key when you look at this, and aging in particular, is it's a normal process. And physiology is the normal function of living organisms and their parts. So it's not abnormal, it's a normal process, and you have to realize that. Can you modify this normal process? The answer is yes. You can slow it down, you can change it to a certain point, but you can't stop it. It's a normal process. Okay. The other thing about physiology and aging in general is it affects every part of your body. Your brain, the muscles, your liver, the kidneys, the bone, digestive system, respiratory system. It affects everything, all of your bodily functions. And tonight what we're going to concentrate on is the cardiovascular system. So aging is not a disease unto itself. Everybody seems to get this idea, or not everybody, that when you age, it in its own self is a disease. Aging is not a disease. You really have to look at it as a normal process. And again, when we have that distinction in the emergency department with elderly and geriatric emergency medicine, it takes this into account because elderly behave, react, and respond differently, but it is still a normal process. It's very complex, and it's dependent on a lot of internal and external influences. If you take a look at a little formula on aging in general, it follows what's called the rule of thirds, and it's 1/3 normal physiological aging, which we're going to go over. So that's just 1/3 of it. The other third, which is a big third, is the influence of diseases and the disease processes that you get. Not everybody gets diabetes, not everybody has COPD, not everybody has a heart attack, not everybody has things like leukemia, but the influence on aging is 1/3 due to your disease processes. And the following, I think, is extremely important: 1/3 due to disuse. And in particular, as you get into the elderly population, the disuse becomes a problem. But even before that, in people even in their 40s and 50s, it is an issue. So I think it's very important to understand that third. It'll come up again. So this is just a picture of a graph of everything that happens to your body as you age. And aging starts at around 30, believe it or not. And you can see a downward trend on every single one of those lines going down. If you take a look at age 60 with what's called the cardiac index, because we're looking at the heart itself around 65 starts to level out again, but the heart has aged to the extent that it's going to by the time you're 75. Once you pass 75, it doesn't age much further. Some of the other things that are in there at the very top is your nervous system. It slows down as you age, hence you can't react as quickly as you could before. Other things below that red line under cardiac index, your kidneys age over time, and also your lungs. Those are the other ones that are on this slide. So let's go to physiology of the heart itself. And it comes back again to the rule of thirds. It definitely follows that. And the normal aging there is for 1/3. The concurrent diseases that affect the heart are really ones that affect a lot of areas in the heart, in the body. But all these add up and affect the heart more than any other organ in the body. So you can have concurrent diseases such as high blood pressure, diabetes, COPD, and high cholesterol, all adding into the aging of your heart. And you can alter the course of those and take the weight off your heart to alter the course of the aging of the heart. And I come back to that 1/3 disuse, which again is extremely important for the aging of the heart. And the aging of the heart, just like aging in general and physiology of aging, it does vary greatly from person to person. And the question always comes up, does genetics play a role in aging? And it certainly does. 25% may be due to genetics, but still it is currently not well understood how it affects the aging. Everybody's looking for that golden aging gene for perpetual life, but it hasn't been found yet. So a little bit in physiology just about your heart, just to give you an idea of what your body does over time. Just taking a look at what happens with your heart and how it beats from the time you're born until the time you're 75. So an average heart rate's 60 to 100. We're going to use 70, which is a good estimate. So in an hour, you beat 4,200 times. In a day, it's 100,000 times. Within a month, you're up to 3 million beats. In a year, you're at 36 million. By the time you reach age 65, you're almost at 2.5 billion beats. And at the time you reach 75, you are now at almost 2.8 billion beats. So it's no wonder that the heart itself does tire out over time. That's quite a significant number, almost 3 billion beats by the time you're 75. So now a little bit about the anatomy. And again, I'm going over this and some of the diseases that occur with your heart, with the physiology. Try to keep it simple, but I think it's really important for people to understand some of the lingo that doctors will be using when you see them, so you understand it. And I'll keep it simple and not too many terms. But it's really important because when they start telling you what's going on with your heart, it's important to know. So think of your heart as a pump. And this is the type of pump you have out at your camp. One end's in the lake and the other's going into the taps. So it's something everybody sees. You have to fix it. You have to fix the valves on it. You have to fix the pump. You have to change a filter, all that types of things with a pump. So with a pump, you're going to have an input coming in from the lake. You're going to have an output going up to your taps. That's the same as a heart. You have an input coming in and output. Then you have the pump itself that pumps, and the heart's called the dual chamber pump, really. It has 2 chambers that it pumps from. And yeah, the pump proper there, and you have the valves, one going from the lake and one going up to the plumbing. And the other big thing not to forget about is that little black thing on the floor there is an electrical cord, and the heart has an electrical cord too. So I'm going to try to explain the heart and its anatomy and how it functions in terms of a typical pump that you would be using at your camp. So this is the heart. It's really the equivalent of 2 pumps. The one on the left side of your screen that's in blue is the right side of your heart. It's opposite to what you're looking at, the way you're looking at it. And the side of the heart that's red on the right side of the screen, or the left side of the heart, is called the left side of the heart. On the right side of the heart, the arrows will light up here. The oxygen comes in from your lower body and your upper, sorry, not the oxygen, the blood comes in from the lower body, and the upper body comes back to the heart, into the right side of the heart, into a thing called the atrium, which is then pumped into the ventricle, which is then pumped into your lungs. And in your lungs, it circulates and oxygen is put back in and it's returned back to your heart. And it now goes to the left side of your heart and it goes into the left atrium, which primes the pump. The atrium always prime the pump into the left ventricle, and from the left ventricle, it goes out to the rest of your body. So hopefully people understand that the right side of the heart, which takes blood that then goes to the lungs, and it comes back from the lungs with oxygen and goes to the body to provide oxygen to the body. One other slight point here is right here, your coronary arteries are off that side of the heart and provide the blood with the oxygen in it to the entire heart from those little arteries coming out. And this again is more for knowing the lingo too. If you've had heart problems and you've had an angiogram or you've had what's called an EKG, angiograms where they put the dye into the vessels, you'll hear these terms. And really there's only 4 main arteries of the heart. There's what's called the left coronary, then the left coronary branches into a circumflex, an anterior descending, and then there's a right. So I'm trying to make it fairly simple, and you can see that the right coronary supplies that part of the heart where you had the blood going to the lungs, and the left side of the heart, where there are 3 arteries, supplies more of the pump heading out to the rest of your body with the blood that's full of oxygen. But when you hear these terms from your family doctor or primary care provider or specialist or cardiologist, this is what they're talking about, of the arteries that are on the surface and eventually go into the muscle of the heart to supply them with the blood. And it's important because we're going to talk about those with the aging heart and how aging of the heart affects those arteries. So the other big thing to understand about the heart, like the pump, that black cord that was going to the pump, everything needs electricity. So does the heart. And on the left side of the screen, it shows you all of the nerves coming down from the brain at the top. They come down through your neck, and they eventually come down through your chest and go around your heart and within the heart. So those are all the yellow lines. So it's really important to understand that there's an electrical component to your heart, electrical cord. When it goes into the heart, it follows a chain of electrical cords. And again, you don't need to know these names. I'm just putting these up to show that there's a pattern. This is the pacemaker. Everybody's heard of a pacemaker. Well, this is the pacemaker of the heart, which then goes to another specific part in the middle of the heart, which then divides up and goes into your right and left sides of your heart. So just think of this as a plug-in and then an extension cord that starts branching off. And then eventually it goes to the left side of the heart and the right side of the heart. And finally, it penetrates into the heart. And this is all your Christmas tree lights up. And it goes into these little fibers that supply the electrical charge to the muscle themselves. So remember, there's an electrical component of the heart, and that's just as important as the pump itself. So we've passed Anatomy 101 at this point. And now we're going to go into the actual heart itself and what happens with aging. So with aging, it happens over time to different degrees in different people once again. And again, you can modify this by modifying that third, and third. So with time, what happens is you get a decrease in the number of what's called heart cells, which are called myocardial cells. So they decrease, but at the same time, they increase in size, and they just don't work as well. There's fewer of them, and they don't work as well. So overall, this causes a decrease in the way that the heart can function, the cells can function. And because they're larger and a little more flexible, the heart wall tends to stretch. And on top of that, there's the stretch of one side of the heart. On top of that, aside from stretching and enlarging the chamber of the heart, and again, this happens with time, it happens to everybody, you get a protein in your body that for some reason likes to go into the heart, and it causes it to be stiffer, not as elastic. It loses its elasticity and the compliance of it. And the heart, when it stretches, is more stiffer, if it's a word, and more rigid. So that's normal. That goes on with time and varying degrees over time, but it does affect the heart. With age, you see this change in the heart itself. The other thing that happens with that stretching and becoming more rigid, it loses its strength. Its contraction isn't as strong. And when it isn't as strong, it's not as forceful. The amount of blood that's pushed out with each heartbeat, and we go back to that almost 3 billion beats, as you get older, the amount of blood that comes out with each heartbeat is less. So now I'm just going to talk about the physiology and what happens about the heart and its functions as you get older. Again, normal aging of the heart. And I want to give these terms so that you can understand them in the future, again, when speaking to your family doctor or your specialist. So these are things you'll hear. So you don't have to know them, just know that they're associated with the heart, and they do change with time. There's a thing called cardiac output. I'm not going to go into the specific formula for it, but they'll talk to you about that. That's how much blood is essentially pumped out of the heart within each minute. And then you'll hear this more often, and this is how they measure the heart over time, the cardiac index. And that just takes into account how large you are. Smaller people obviously will have less blood and less body tissues to take blood to, and larger people will have more. So they relate how your heart is to how large you are. This is something you may hear also, something called the ejection fraction when you're seeing a cardiologist. And it's actually very simple if you think of a measuring cup. It's not that complicated in the least bit. If you take a look at your heart, and in one of those chambers I showed you, normally it holds 100 mils of fluid. And this is a recipe, and you filled your measuring cup up with 100 mils of water. And then the recipe only calls for 60 mils. And so the measuring cup beats once and puts out 60 mils of water. So if you take a look at how much blood is in that chamber of the heart, then the heart beats, and out of that beat, 60 mils go out. That's 60% of the blood has gone out, and that's called the ejection fraction. And you may hear that from your family doctor again, or your cardiologist. And these are the ejection fractions you can get. And it does change as you age. You go down in your ejection fraction as you age. Again, the heart is stiffer, not as compliant. Top athletes will be in the high area with high amounts of blood put out with each heartbeat. The normal is 46 to 70%. And once you go below 46%, it becomes abnormal. And so you may hear a number from your family doctor or cardiologists where they say it's 40%. So that's low, may or may not mean anything about the treatment. But once you get below 35, it means your heart really isn't functioning that well. And as time goes on, the ejection fraction and the amount of blood it pumps out goes down with age. That's normal. This is normal. This again is a normal graph. This is that cardiac output I was talking about, where you just take the amount of blood that is pushed out with each heartbeat, multiplied by your heart rate to get amount of blood that's pumped out of your heart per minute. And you can see with time, starting at a young age, and it's surprising at how young this starts, that around 30 to 35, even as you reach 20, the function of your heart starts to go down. It doesn't mean it's abnormal. It just means with age, it ages, it starts to wear out. And again, with that 3 billion heartbeats over your lifetime, it's not surprising that the heart starts to wear out. So again, you may hear the term cardiac output. And so this just shows you that normally, this is a normogram. This is normally what happens with age. So with aging, this is another part that happens. And again, I think it's important to understand that the heart, being a pump, needs electricity, and there is an electrical component to the heart as well. And so you have what's called the pacemaker cells. I mentioned that before, in that one node at the top, and the sinoatrial node, but you lose a lot of the cells in that area of your heart with time. And again, that is normal. So by age 70, only 10% of those pacemaker cells are left in your heart, and they pace how your heart beats. So this declines, makes it such that as you age, your heart can only put out a maximal heart rate. When you're super young and very fit, basically your heart cannot go over the heart rate of 220 in upper tier athletes. If your heart goes above, on average, at age 31, if it goes above a heart rate of 190, the heart may revolt and not beat properly, and you can actually go into a cardiac arrest. But your body won't usually let your heart go that high. But what you do need to realize is, as you get older, the electrical system, the conduction, the amount of amps going through that system decrease, and over time, your heart can only get up to a maximal heart rate. So by the time you're 60, the average maximal heart rate that your heart can get up to is 160, and by the age of 70, it's going to be 150. So that's important to know, that the heart, you have to watch it as you get older. In your exercise, they usually give you a maximal heart rate that you should go up to, depending upon your age and medications that you're on. The other thing that happens with the electrical system, you can imagine if you took an electrical cord and started stretching it, as I mentioned with the muscles, when the heart is a muscle, it stretches, and so with that does the electrical system. And if you stretch it enough, you can imagine, as with an electrical cord, you get a short circuit. And this can happen with the heart with age. And with that, you can get a condition called atrial fibrillation, which I think a lot of people are familiar with or have heard of, or you may hear from your family doctor. And usually when you have a heartbeat, as I say, it starts in that one area of the heart and then goes through the electrical cords there in yellow. When you stretch the heart, you stretch those electrical cords, they short circuit, and then all of a sudden you get all sorts of parts in that side of the heart wanting to be a pacemaker for the heart, and you get them all over the place. So what happens with that is you feel palpitations, you feel an irregular heartbeat. The bottom left just shows you what a normal heart on what's called your cardiogram looks like. You can see those spikes are normal and regular, and going at about 70. When you get atrial fibrillation with all that stimulation from different areas of the heartbeat becomes irregularly irregular, as shown here. And so you can see those spikes don't really have any pattern to them. And that's called atrial fibrillation. It again may or may not be treated. It may be there permanently. It may be there off and on. But this can happen with aging of the heart. And it can, in a sense, be considered a normal part of aging of the heart. Certain things can affect it. Concurrent diseases, alcohol is a big factor too. But this can occur in the normal aging of the heart. And often it will need to be followed if not treated. So the other thing that can happen to your heart I mentioned with the pump, you have the valves and you can get problems with the valve. There's the 4 valves. There's this one here on the right side of your heart that takes it from the primer into the main pump on your right side, which pumps it through this valve here. And these are just sort of check valves like you'd have in most water systems so that the flow doesn't go backwards once you stimulate the pump. So the pulmonary valve there prevents the blood from coming back into the right side of the heart and makes sure that it goes to the lungs. When it comes back from the lungs, it goes into the priming pump, the left atrium, which then primes the pump through the check valve here, which is the mitral valve. And then finally, it's pushed out to the rest of your body through this aortic valve. And so there are 4 valves, and these can also age. And again, this is a normal process. So what can happen with these valves over time? At the top in the picture, there's a normal valve. It has 3, as they call leaflets. You can see 3 triangles there. And in the very, very middle of the white lines, you can see a small, small triangle. That's the opening, that's a closed valve. And that's the only part that's open. As you age, which is at the bottom part, you get thickening and scarring and fibrosis of the valve. Again, this is normal, and it can become calcified, the little white spots that are on that valve in the bottom picture. And it becomes stiff, and it becomes stiff to a varying degree, and it becomes stiff enough that it causes problems. It's called stenosis. And again, a most common one that you get is called aortic stenosis. You may have heard of, or you may have had a friend or a relative that has had it, and they follow that very, very closely. The other thing that occurs is regurgitation. Again, in that bottom one, you can see how when the valve is totally closed, there's a lot more opening in that valve compared to the one above it, where there's a tiny, tiny little triangle that's open and blood can flow backwards. And people may have heard of microregurgitation, a fairly common thing that's usually benign, not serious. But again, that's a term you may get from your family doctor or cardiologist. Okay. And this valvular problem may result in chest pain, dizziness, shortness of breath, fatigue, or you can get atrial fibrillation or the fluttering of the chest. And again, this just shows on the diagram on the right, on the top left, the normal valve when it closes, and below that, normal valve when it's open. And then on the far right bottom is the opening in the stenotic vein. You can see the restriction between the two. And then again, on the top right is the closed one. And again, you can see, although it's closed, how much more opening space is in there. So one of the main take homes from this talk, I've noticed through my career, some of my colleagues may not listen to hearts. And a major takeaway is always have your primary care provider or physician you're seeing, and I include nurse practitioners in this, listen to your heart for murmurs. Again, as I said before, aging of the valves is normal. It occurs more rapidly in some people than others and is modified by certain diseases. But have them listened, because you can pick up these, and the main reason you need to have them picked up is so that they can be followed along to make sure that nothing has to be done with them. And I think it's really important for primary care providers or any physician that sees you to listen to your heart. Now, just quickly, because I'm looking at the time, go through this part of it. This is where the damage occurs to your heart with the physiology, the aging of the blood vessels. And this happens in those vessels I showed you around the heart. And they develop plaques, and you can see those in the yellow in the diagram. And eventually they may rupture. We see it more in the industrialized country, and it's likely because of the diet. So again, a modifiable thing to prevent this from going on. Again, this happens in everybody, but it accelerates with certain things, especially your diet or diabetes, if it's not under control. And the most common area where you see this in the body is in the coronary arteries, the heart arteries. And what happens in the heart is the surface of those plaques can get rough, it can rupture, and I get a plaque rupture. And what happens, it's a rough area, so it forms a clot. The clot will then block the artery, and then the artery will then have no oxygen going downstream from it, and it will cause a heart attack or what's called a myocardial infarction. And so most often this will affect the muscle of the heart. So you have that occurring, but it can also affect the electrical system of the heart too. So don't forget that's embedded in the heart, the electrical system. And over time, if you have multiple small insults to the heart like this, you do end up with damage to the heart, accelerating the aging of the normal heart and the functioning of the normal heart. So the aging heart in general, it affects different people over different times, over different time frames, but there's a lot of things that you can do to prevent it. And what can you do? Well, think what's important about the impact on your heart that you can have is this talk tonight. Be aware of your body, understand the changes that will occur, and some of them are normal, if not all of them. Make regular appointments with your family doctor or your primary care provider. Always have them listen to the heart. And respect concurrent conditions. Control your diabetes, control your hypertension, be cognizant of kidney disease. Again, regular appointments and follow-ups to the family doctor are very important for this. I've mentioned about the heart murmurs again. I've seen so many people in the emergency department with a heart murmur. I always tell them they have it, and I'd say 99% of the times it really isn't that much. I just say, make sure your family doctor listens and just monitors it. Be compliant with your medications. They're very important, and a lot of them can affect your heart. And always err on the side of caution if you feel anything's going on with your heart, if you're short of breath, you feel palpitations, that type of thing. What else can you do? You can follow a heart-friendly diet, low sodium, low fat, and Dine with Doc was there up until COVID hit, but that was a healthy diet evening with recipes and Dine with Doc. Minimize the alcohol content. Don't smoke. I showed you at the beginning, age expectancy with smoking. Monitor your blood pressure closely and keep up with physical activity. I didn't go over that much in the talk, but it is extremely important. Your heart's a muscle. It needs to be exercised. If it doesn't exercise, it atrophies. It gets weaker. So it's very important. Speak to your primary care provider about what's best for you, considering your age and your concurrent conditions. But even if you have heart disease, heart failure, any of those things, some type of exercise is important. And every year we have Walk with Doc that's on our website, which promotes a healthy heart through exercise. And all those things, when I was going through this talk, that you could do to prevent or alter the route of aging of your heart, not prevent aging, but alter the route of aging of your heart, really is the mission of the Northern Hearts that I gave you at the beginning. So remember, aging is a normal process, not a disease. It goes by the rule of thirds, one third normal. So you can, 2/3 of it can be varied by controlling your concurrent disease and exercising. And again, I want to put that emphasis on the exercising, which I didn't do as much during my talk. Try to remember a bit of the anatomy and physiology. I hope it wasn't too high level, because I think it's very important to understand what's going on when your primary care provider talks to you about heart conditions of yourself, your family, or relatives. And it also help understand what they may be talking about when they talk about treatment for your heart. Aging occurs different rates with different people. Treat your heart well, watch your diet, exercise, quit smoking, follow your prescriptions, and see your primary care provider regularly. And I believe that's the end of the talk.
Thank you very much, Dr. Affleck. That was so very informative. I noticed there was a question here in the question and answer, so I'll read it out because most of the attendees may not be able to see what the question is. I have a family who have passed from heart attacks. I eat healthy and exercise. Is there a genetic component to this as well?
There likely is. We just don't know what exactly that genetic component is. For instance, it's well known when people have heart attacks um, that it does run in families. So we can say if somebody in your family had a heart attack at age 40, you're going to be more likely to have a heart attack. So it is a risk factor for sure. But exactly what the modifier is, we don't know. So if somebody does have heart disease, especially what's called coronary artery disease, hardening of the arteries, or who have had a heart attack or what's called a cardiac arrest in your family, it is one of the risk factors for heart attacks for yourself. What that risk factor is it a protein? Is it a gene? We really don't know.
Thank you very much. Are there any other questions that any of the attendees might have at this point? Certainly you can put them into the question and answer session. Hopefully you have a button on your screen. Dr. Affleck, I'll just give a moment for anybody that wants to respond. While they are doing that, I just want to say on behalf of Northern Hearts and for all of us in attendance, thank you so much. That was a very informative presentation. I'm a visual learner, and your illustrations really do help bring some of that learning to point. You can see the attention to detail that you put into this presentation. You can see why you were such a great physician, and thank you for obviously taking time to serve all of your patients over the last 35 years in Thunder Bay and Northern Hearts. We feel very fortunate to have you on our board of directors. It doesn't appear that any other questions.
Still a few on, Brian. I was just going to mention just exercise again, because I didn't go into it a lot. This picture, the background picture here is the Walk with Doc. It's the background picture for our website. And there was some resources I put there for people at the very end of this talk. It'll be online on Northern Heart's website. But I emphasize the fact of exercise for the heart. Exercise unto its own, and even walking, is so important for everything. It's important for your brain. It's important for your lungs. It's important for your kidneys, your muscles, your joints, and also your heart. So exercise, even if it's just walking, and you get limited in your exercise as you age, for sure, and quite variable, but even some exercise is better than no exercise during the day.
Excellent advice, Dr. Affleck, and I'm glad you mentioned the Northern Hearts website. We make every effort to put educational materials on our website and encourage all the attendees. If you're looking for information on heart health, please visit our website at northernhearts.org. We also, for each week, we do a.
Sorry,
Okay.
Brian, there's another question. Sorry to interrupt you up there, but another question. Dr. Lau is actually on this tonight, and I think I know exactly what he's going to say as a comment, but can we get him on?
I don't see the question posted at this point.
Yeah,
Dr. Affleck.
Chris, you'd have to, I don't think you're on there as a participant. You have to type it in. Once I saw his name, it just hit me that when I was talking about exercise, Dr. Lau's done a lot for our community. He was actually ahead of his time in looking at what helps hearts, and well before Northern Hearts, Dr. Lai was doing things that other people started doing later to help people with hearts to rehab from heart attacks. And he started an exercise post heart attack program that at that time hadn't been necessarily shown to make any difference, but he went ahead with it, and he showed a tremendous effect of regular exercise, regular physiotherapy, for people with post heart attack, post MI, myocardial infarction, and better life afterwards, more longevity. And I just give a shout out for him because I think that's what he's going to talk about, how even after you've had an insult to your heart, whether it be from a heart attack or have the electrical problems I was talking about, staying active is so important for your heart health. Unless there's another Q&A up there. I'm trying to get it. I can't see it. Oh, Chris was just thanking me.
I believe Dr. Lai just messaged
He was
you.
saying thanks, but it just hit me as when he came up and mentioned that I when his hand went up, I had to mention the program he started even before the study showed that exercise improved your outcome with heart attacks.
See, Dr. Lai also suggested he advises them to dance before they stand. So that's
Yeah. So the other thing I
stay
didn't
active.
mention in there is the other thing that happens. Everything slows down in your body as you age, and as I said, the conduction in your heart and your electrical system slows down. So does the all the conduction and all of the nerves in your body. When you stand up, there's a signal to your brain that you're standing up, and it signals your heart to adjust to affect your blood pressure. As you get older, that signal is slowed down. So if you get up fast, you may get lightheaded and faint. So Dr. Lai is exactly right. You need to sort of dance and move your legs before you stand up.
Well said.
Sorry, yeah. I actually joined just after you finished your introduction, Brian, and then I left just as you were answering that last question. I had to go deal with my 2-year-old, but that was a very good presentation. Thank you both for sort of organizing it and running it this evening.
Great.
Much appreciated.
My pleasure.
I should mention, Gavin, that and for the attendees, that tonight's webinar has been recorded, and we're going to post a link to that video on the Northern Hearts website. We'll probably end up putting the video itself on our YouTube channel within a day or two. I was commenting earlier that for those of you interested in more information on heart health, Northern Hearts posts weekly content on our Facebook page. So please visit and share the information with anyone you feel may benefit from that. You'll likely within the next day or so receive an email follow-up to tonight with 3 short survey questions. We'd appreciate if you'd take time to give us your feedback. And once again, thank you, Dr. Affleck, and thanks.
I'm going to give you
attending.
one other caveat from Dr. Lai as we sign off. He says, watch your favorite show, but not the advertisings. If you think about what he's referring to, as you get older, you're often watching TV at night. And a way to exercise is that watch the show, but when the advertising comes on, get up, walk around, do a few laps around the kitchen or around the living room, get up and walk around, and then come back when the show's back on.
That's good advice. Dr. Affleck, there was one more question, if you don't mind taking a moment. How long can a person with CHF live with a pacemaker?
So it's quite variable. CHF is a condition of the heart where really the muscle doesn't pump nearly as well as it should, and everything backs up in the system. The pacemaker then is one that affects the electrical component of the heart. So they're 2 different issues. And often when you have a pacemaker, it just kicks in when the electrical part fails. So the 2 are sort of mutually exclusive, but also work in conjunction with each other. But if you follow the same things I just mentioned, the rule of thirds, and look at the 2/3 you can modify. You can modify how long you live by doing those things. Watching your disease, treating your diabetes, good blood pressure control, and diet and exercise. Even with pacemaker, you can get up and walk around so that you can do those things to keep your heart going. I can't give you a specific sort of number because it varies from person to person, but they are a bit mutually exclusive, but tied together.
Thank you very much. Gavin, was there anything that you wanted to add in closing?
There's not. I would just like to say thank you, everybody, for joining the
Yes, thanks,
webinar
everybody.
tonight. And thanks again, Dr. Affleck, for
You're welcome.
participating and for all that you do. It's very much appreciated.
Okay.
Yeah.
Thanks, Gavin.
Thanks again, Dr. Affleck, and obviously to all our attendees, wishing everyone a healthy heart. Have a wonderful evening. Dr. Affleck will let you do the controls to end the session.
Okay,
There we go.
and end.